Hi guys, Eric Beard back. Wanted to take a few moments and talk to you a bit more about thoracic mobility. Talked about it in some of my other videos and just had a wonderful presentation at the Perform Better Functional Training Summit out in Chicago this last weekend, and also did a one-day on Boston on the subject earlier on this year. Thoracic mobility, pretty important. We know most people move too much through the lumbar spine and not enough through the thoracic spine. There might be some great targeted techniques that we can use to open this part of the body to get some nice rotation through the entire thorax. But I do want you to pay attention to the rest of the kinetic chain. I'll give you an example of a thoracic mobilization from a split stance or standing position. I believe the first place I saw this was from Chuck Wolf and Human Movement Associates. And I want you to take a look at the mobility required at the ankle as well as the stability required at the hip to be able to perform this correctly. You're going to get into a split or staggered stance. Start out tall and then you'll lean in. You do need dorsiflexion of the front as well as the back ankle to perform this correctly. Maintain cervical neutral. Start out with your scapulars retracted and depressed. And then you're going to reach with the right shoulder blade, right upper arm towards the front. Pull the shoulder blade back. Think of reaching forward with the shoulder blade, not the humerus. Pull all the way back. Other cue, think of the belly button like a light. Light's going to shine this way, light's going to shine that way. So not only are we trying to get some transverse plane action at thoracic spine, we're working on hip internal and external rotation. We're working on pronation and supination, the foot-ankle complex as well. Let's give you a lateral view of the exact same movement. I'll just switch sides here. We'll lean in. So we need bilateral dorsiflexion. We need some stability to be able to hold us here in alignment. Starting off retraction, depression, external rotation. Belly button is leading the way where we go. Belly button is leading the way across the body where we go. You can perform these for repetitions, 8 to 12 reps, 8 to 15 reps, just to get a nice movement. I prefer to do movements like this after my soft tissue work or rolling. I then like to get in a static stretch. Actually, I'd like to get my joint mobilizations in first, then a static stretch if needed if I'm really locked up. And then I'll move into something like this, what some people might call more of an active, isolated stretching technique, or closer to that dynamic flexibility technique, or some people will just call it a mobilization. It doesn't really matter what you call it, but the concept, release the tissue, free the joint, elongate any tissue that's stuck around it, and then teach the body how to control that in all three planes of motion. I hope this has been helpful for you. You'll get a split stance, trunk rotation for thoracic mobility. Thanks for watching, and have a great day.